Do you know someone who suffers from chronic low back or hip pain? Many people turn to pain relievers. Problem solved. Or is it? Is low back or hip pain caused by being born with not enough medicine in the body? Of course not. Medicine may temporarily cover the problem, but it does not fix the cause. Without fixing the cause, the pain most always returns. Because low back and hip pain can prevent most daily activities, people often overdo it with pain medication. This is dangerous because pain medicine can be highly addictive. What is low back and hip pain? They are both symptoms. The body's way of alerting us that something is wrong. Low back and hip pain begin stress. Stay tuned to find out what kinds. Stress, regardless of type, causes vertebral subluxations. Subluxations keep the spine locked in the wrong position while preventing the nervous system from working properly. Symptoms like back and hip pain result. Removing subluxations can relieve pain, without the use of drugs. Subluxation? What's that? A subluxation is a condition in which a spinal segment is out of alignment with the adjacent segment. Nerves, which branch off of the spinal cord, no longer properly work. Subluxations lock the joint's motion so they do not receive the nutrition they need. Simultaneously, the body receives more pain stimuli. The person in pain will feel worse. Not to mention, pain often begins after a subluxation has been there a while. Therefore, just because someone feels healthy, does not mean they are healthy. Cool fact, only 10% of the nerves feel pain. Yep, that's a small number. And the reason why someone could have subluxation without being in pain. What types of stress lead to low back and hip subluxations? Let's have a Jeopardy quiz. Performed upon hard flooring, this household chore done while bending at the waist, instead of standing upright, places great strain upon the low back. Clue: the industrial type needs to be wrung out. What is mopping? The mopper should stand in a slight lunge to prevent bending and twisting. Hips and shoulders should move in the direction of, and along with, the arm's motion. Another quiz question. Parents carrying this on their hips is a hard-to-break habit that subluxates the lumbar spine and pelvis. Clue: having it is what makes someone a parent. What is their baby? A sling or carrier saves the spine and frees the hands. A bonus? Research shows that a baby will cry less, feel most safe, and be most alert. One more quiz question. Hungry? Perhaps someone does this household chore 3 times a day. They should not do it while bending from the waist. Clue: the word also refers to a circular item installed on a roof, which enables cable television. What is doing the dishes? The washer should not bend over the sink to reach the dishes. Dishes should be placed upon a top of sink dish rack, so bending is not required. I guess we'll do another quiz question. Despite the spinal consequences, female and male often choose this type of footwear because it's easy. Clue: it couldn't have any less of a heel. What are flip-flops or any flat shoe? With no cushioned heel, the feet and spine are left to absorb the shock of walking. Body weight shifts to the sides of feet, subluxating the pelvis. These are only a few types of stresses that can subluxate the spine, causing low back and hip pain. Removing subluxations can relieve pain and strain, without the use of drugs. Do you have a friend or loved one who suffers from low back or hip pain? Ask your chiropractor for your copy of low back and hip pain information to pass along, so your loved one can finally find relief and live the life they imagine. You can help change someone's life. What could feel better than that? The physician should not treat the disease but the patient who is suffering from it. Find out how Dr. Ries, your Ries Chiropractic and Bodywork, can help you get rid of your low back and hip pain problems. Call 707-962-3067 today and put a stop to your low back and hip pain naturally. Schedule an appointment with us today and see the difference.